So here we are at episode 5 of Drug Free Australia's Injecting Rooms Scams series. In this episode, we are looking at whether injecting rooms can actually reduce the transmission of blood-borne viruses. Exactly what are these blood-borne viruses that we're speaking of, and how are they relevant? We're speaking of hepatitis B, hepatitis C, HIV, and they are mostly spread through users sharing needles, of course, which are used for injecting their drugs of addiction, and these viruses can increase mortality. With the Sydney's 2003 evaluation, this is the one you see over on the right-hand side of the screen, monitoring the first 18 months of operation, they found that Hep C and HIV were increasing in the community. In other words, the results were worsening over here, and they were not decreasing. With Hep B, hepatitis B, there was no improvement. And you can check this all out for yourself by going to the link displayed in the description of this video, where you actually see the PDF of the PowerPoint. By the 2010 evaluation of the Sydney facility, nothing had improved. And the KPMG evaluation conveniently forgot to mention that there had been a heroin drought since 6 months before the injecting room opened. And of course, things should have very much improved over all of those years because of the heroin drought, but not a mention. The 2020 evaluation of Melbourne's first 18 months of operation said this: there is not a significant difference between injecting room service users and other people who inject drugs in reporting that they had injected with someone else's used needle or syringe in the previous month. Let's go to Vancouver, where we have conflicting claims of 35 new HIV cases averted annually and 3 lives saved via their mathematical modelling. Note that they're not looking at community results at all, but just doing some mathematical work. And 2 years later, there was another study that took issue with their overblown claims, suggesting that it was only 4 to 8 cases less in a year. So let's do a little bit of a reality check and just test the modelling that we've seen. Remember that these blood-borne viruses are passed on by sharing used needles. They're infected with the viruses in someone else's blood before being used by another person. And so we can learn something here from needle and syringe programs, which give out clean needles and where staff teach recipients to only use clean needles. Now, we've got to ask the question, do these programs work at all? Do they reduce blood-borne viruses in the community? Well, in actual fact, they don't. In 2006, the US Institute of Medicine produced the world's most extensive review. There were 24 scientists, medicos, and reviewers involved in that review, and they asked, do these programs work? Starting with hepatitis C, the most virulently transmissible virus first. And they said in their review, multiple studies show that these programs don't work. Well, what does that mean? It means that drug users are still constantly sharing needles despite being given as many clean needles as they want. What about HIV? Well, from the Hep C results, we know that the needles are being shared regardless of the program and the provision of clean needles. But we also know that HIV is not as easily transmitted. And what does the science say? It says that evidence regarding the effect of needle and syringe exchange on HIV incidence is limited and inconclusive. So what do needle and syringe programs have to do with injecting rooms? Only a tiny percentage of users' injections are in these facilities. Users average about 1,100 injections per year, but average at best 1 injection in a facility per month. That's not a lot, or 1 in every 90. Like the clean needle programs, the injecting rooms teach users to use clean needles and ensure that, of course. And injecting rooms do exactly the same in terms of teaching as do the needle and syringe programs. But there is no likelihood, as we have seen, that it changes behavior at all, nor reduces cases or saves lives. Well, just as the needle and syringe programs have shown no success, neither have the injecting rooms. And the Vancouver mathematical modelling is shown to be fanciful on that reality. In our next episode, we look at the question, do injecting rooms reduce overdose callouts for ambulances?